Hello, I'm Perrin and welcome to the Business of Business. Throughout the pandemic, we'll be having a series of conversations with business leaders, government officials, and other experts with regard to the impacts of the pandemic and what we can do to help Canadians and Canadian businesses get safely to the other side. Today's program is different from most in that I have two guests today, both of whom are colleagues and friends of mine. They're Ian Mclean from the Greater Kitchener-Waterloo Chamber of Commerce and Greg Durocher, who is the president and CEO of the Cambridge Chamber of Commerce. Welcome to the Business of Business.
Wonderful to be here.
Great, thanks for having us.
The reason, Greg, let's start with you. The reason why I wanted to have a chance to get together with you and share this across the country is that your two chambers have come together in a very bold new initiative to help SMEs in your communities. First of all, with regard to rapid screening, but also in other ways to help them during the pandemic. And this is innovative. It is cutting edge in terms of Canada, and it's generated an enormous amount of interest across the chamber network and among SMEs. Can you describe the program that you've established and why you got into it, what the impact is, and what sort of take-up there's been in the community?
We certainly wouldn't define ourselves as being experts. And I think we were all in the same boat as everybody else when March of 2020 came along, and we all looked at each other like, what's next? And Ian and I have been really good friends, close friends for a number of years, ever since, Ian took over the Greater Kitchener-Waterloo Chamber of Commerce. But we have a real special relationship between the two of us, probably maybe more akin to brothers than colleagues. But we also recognized that we're in a region that is, doesn't define the boundaries of the individual municipalities within the region. And we know that our efforts and our works that we have collaborated with in the past have been very important to SMEs within our region. So we really immediately kind of came out of the gate thinking, well, if we're going to do something big and bold, we kind of should do it together because everybody's feeling exactly the same pain. So we started off Axonify, a software company that does a lot of training videos and self-help videos for business, came to us with a pilot that they had done in South Carolina or North Carolina and said to us, would you folks want this? And it was basically a training program for COVID safe protocols. And we said, well, sure, why not? You're giving it to us, we can collaborate. And so we both did. We jumped in with both feet. Our staff got in there, tried to help massage the information that was there. And then it started to evolve. And because I think both of our organizations, individually, Ian and I, but our staff as well, who work very closely together, said if we're really going to make an impact on SMEs in this pandemic and really give some help and support, we need to unify our efforts. So we actually created a website that was kind of an independent website where both of us could share our information, best practices, and feed into it all of the information that both chambers of commerce were gathering or programs that we were doing. So we created a website called chambercheck.ca where there were these learning tools built into it, but then it gave us the ability to start adding other programs where we disseminated all the government programs and links there so that there was a one-stop shop for it. But most importantly, it kind of let us and our staff sit down, and any new initiative or idea that Ian and I brought forward or the surrounding business community brought forward, we had a really easy and simple platform to be able to launch it region-wide. And that's when we got into the rapid screening kit distribution program on a pilot with the federal government. It really made it easy for us. We knew exactly where we were going to launch it from. We knew where we were going to put everything. And it just became an obvious step for us. And, I think in reality, when I look at it, I think a lot of chamber colleagues have the same relationship with their peer chambers, one municipality over from them. And this can be replicated, virtually anywhere in the world. And I think our benefit has always been the close friendship that Ian Mclean and I have.
We'll come back in a minute to the broader umbrella of the Chamber Check program, but Ian, let's talk about rapid screening, and let's go back to the fundamentals. Why is it important?
Well, one of the things that we discovered was we've been calling locally here. I know the Ontario Chamber, the Canadian Chamber has, for the tools that business will need to stay open or reopen in some cases safely. And we weren't getting that. Rapid screening is something we've been writing letters about since last May, so almost 11 months. And I think one of the pieces that we've been that sort of broke the logjam, if you will, and I think you mentioned it. You were on a radio show recently and talked about the fact that up until Ontario changed its rules about 3 weeks ago, you had to be a medical professional, doctor or nurse, to administer these Abbott screening kits. And so this is the box of kits that we're giving out, 25 in a box. What we discovered is a well-trained basset hound could administer these tests, and that they are so effective in screening your own staff. I think we're giving, a couple times a week, you want to screen so it's called serial rapid screening kits. It gives you that marker of whether the COVID is in your workplace. So the importance of it for us is we've matched that together. We got a donation, and this is the other part of it, which we put into our chambercheck.ca. The two things that we know every business can do and should do is screen in their workplace, their employees, a couple times a week, and be wearing medical grade masks, because the new variants and how transmissible it is. A medical grade mask, we got a donation of $1.5 million of these types of masks from Eclipse Automation to give to the business community, because they understood how important that was. Those are the two tools that any small business can do to protect themselves, their staff, their customers. And that's the two things that you can do now to protect your business while we ramp up the vaccinations. And so these are easily scalable programs in terms of giving away masks and screening kits to workplaces all over the country. And what we found interesting, and Greg's done a lot of the heavy lifting, put a how-to manual that's now with the Ontario Chamber of Commerce and the Canadian Chamber. So we're open sourcing that and saying any chamber anywhere in the country should be able to do this. Now, there are some limitations on that, taking that restriction off that a medical professional has to administer the test. But as I say, if Greg and I can do it, anybody can. We joke around and say, it was like an episode of Dumb and Dumber, that when we did our launch of this program only 2.5 weeks ago. And I said, Greg, I've never done this. And he said, well, let's do one before we go Facebook Live and go in front of the cameras at CTV. Did this, and I think that was my line to Greg. We did them. It took about, 8 minutes or 10 minutes, got the results. We were both negative. And I said, Greg, a well-trained basset hound could do this. Why were they saying a doctor or nurse had to do it? So it's easy to do. We discovered, we launched that program. We had 3,500 kits. We weren't sure what the uptake was going to be. We had a press conference on Tuesday at 4:30 p.m. Opened the website at chambercheck.ca with the button where people could come in and order their kits. 9 o'clock on Wednesday morning, they were all spoken for. All 3,500 kits were spoken for by 10 a.m. So we knew we had a winner in our hands, because there's that pent up demand for business to be able to take some control for their own business, their own security and safety of their business in a very uncontrollable environment. And so this is absolutely a game changer in our view for Waterloo region. And Greg can go on to this, but I think we've got 40 or 50 chambers that are in Ontario ready to hit the start button on this. And I'm sure it's the same right across the country, because this is something that is easy to do. We already have the network in place. We have we have membership, but we also make this available to any business across the country in our region. So you don't have to be a chamber member. We're making this the economy can't open up just if chamber members are successful. The whole economy has to be safe and vaccinated. So it's incredibly important. And we matched it together with this masking program of being able to give people medical grade masks and screening kits, because they're the two things that we know every business basically wants to do and wants to have that control.
Well, so Ian, the obvious question that any small business would have is, how much is this going to cost me?
Well, Greg and I priced it at a price that no one can say no to. It's all free. And so, to be fair, the federal government has procured and distributed throughout the country 47 million of these Abbott screening kits here, so that they're available. And the idea is that they've already been purchased. We just want to get them into circulation and get them in use by businesses. So our program is pretty simple. Greg's he's graciously hosted as the depot in his office, since it's closed more or less. We hand bombed 100,000 masks off a truck, and we have at any one time usually 20 or 30,000 kits in his office, and very seamless operation where you go online, order your masks and your kits, you come through, you have to watch a training video about 5 minutes, and other than you actually have to watch Greg for 5 minutes on that video. It's pretty simple process, and I think Greg, to date, last I did, 1,000 businesses have already signed up, and 65,000 kits have been distributed in basically 2 weeks, 2.5 weeks. So the demand is huge. And Greg can say more than I can about some of the testimonials that people are from the businesses of what they're saying about what it means to them.
Well, Greg, let's turn to that. What does this mean for an average SME, a restaurant or a small business with a dozen employees somewhere in Cambridge?
You know, Perrin, I had no idea how this was going to affect or be accepted by business, but I can tell you that more than once in emails that I've gotten from companies that are participating, people that have come in to pick up their kits. More than once, I've had that little lump starting in my throat at hearing some of their expressions of sincere appreciation that the Chamber of Commerce is stepping up to provide this for them. I'll have one or a couple of interesting ones. One gentleman came in, I hadn't seen him for about 14 months, and he looked like he was ill. And I'd known him for many, many years, but I hadn't seen him since, probably January of 2020. And I said to him when he came in, I said, Bob, are you feeling okay? And he said, oh yeah, I feel great. Yeah, no problem. And I said, wow, the gray hair really came in like quickly, like it's amazing. And he said, well, actually, Greg, I'll tell you what happened. And he said, ever since March 2020, he says, I get out of my bed and the first thing I do is put my feet on the ground. And he said, the first thing that goes into my mind is an individual employee of mine going to come in and bring COVID-19 into my workplace and shut me down and create havoc for everyone else that works in the place? And he said, I have some elderly individuals that have some underlying conditions that I would really be afraid if they were to catch COVID-19. And he said, then I would worry all day at work and make sure that the protocols are being used. And then I'd worry all night and have difficulty going to bed. And he said, that happened for the last year until I received an email from you that said that these kits were available. And he says, I applied right away and came in and got kits. And he said, I can tell you, I know you've saved probably my business through the balance of this pandemic, but you may in fact have saved my life through the balance of this pandemic. And he said, now you have given me the tool to actually manage my company through this. And one last one that came as a younger fella, he was a little bit tentative, but excited. And he has half of his office staff working alternate days. So he had 5 of his office staff in, and they did their first screening. And he sent me this beautiful note after I shared it with Ian as well, because he asked me to, but he said, we had our first screening today. And he said, we were all very happy because we were 5 for 5 negative. But he says, what really surprised me, Greg, was the feeling of joy and happiness and mental relief from my employees that were there, knowing that they were going to be safe going home to their families at the end of the workday. And, he said, this is as much a tool to keep my workplace safe and free of COVID-19. It's as much a mental tool as well to make my employees feel better and accept more the fact that they're being safe and that their employer is making sure they're being safe. So this is a program that has, it's actually ridiculous that it hasn't surfaced until just recently, and should have been here right from the very beginning.
Greg, these are rapid screening tests, and
Yes.
the advantage of them is that they're so fast. You get a result back within 15 minutes. But an argument that gets made against them is that the level of accuracy is lower than the ones that we would take, where it could take days to get the results back.
Yeah.
Why should these be used if they're not as accurate as the others?
Well, I think, and you make a really good point. You can get the more accurate test, which is only a few percentage points more accurate. The PCR test, it has its faults as well. It checks for a different type of thing. The rapid screening test actually can be more effective on early contractions because it's looking for the actual protein spike and remnants of the protein that wraps itself around the virus, where the PCR test is actually looking for the virus. So there is obvious differences between them, and a diagnostic test, which a PCR test is obviously the mainstay and the gold standard. However, I think what's important is being able to clearly make people feel better and have that early detection approach with a rapid screen. And, if a full PCR test is 98 to 99% accurate, and a PCR test is 89 to 93% accurate, or a rapid screen test is 89 to 93% accurate, I think it's worth that few percentage points to give some validation, some comfort, and a level of security in knowing that that your workplace is a safer place.
And I think the other part, Perrin, on the screening is that I think there's a misnomer that it's far less. It is roughly 90% effective. The important part when we say this is this called, and Ian Klugman, our colleague at Communitech that's been working with the federal government, would say this is what these kits are. And the reason you do them every couple of days or a couple times a week is it's serial screening. That even if you missed it on Tuesday when you did it, if you have it Thursday, you're going to find it. And the important part of the serial part of it, or doing it repeatedly, is that you catch it early, so that before someone's full blown and then spreading it into either their family or in the workplace, that you catch it early. And that's what Greg's getting at, is that it'll catch it earlier. You might have a few more false negatives, I guess is the way to describe it. But if you're doing it on a regular basis, you're not going to miss it very often. And I think that's an important part of this, is that it is worth doing because it is very accurate, but you need to do it in a serial manner, like regularly, a couple times a week, to make sure that you don't miss that small percentage, you don't miss something. And I think that's, Greg, I think that's the best way to describe the efficacy or the reason that any business should want to do it.
And the alternative being that you could have somebody who may be asymptomatic but is carrying and spreading the disease in your workplace in the meantime.
Yeah, and I think that's the important part about it, Perrin. The important part about it is, according to the federal statistics or Health Canada statistics, a third of everybody will be an asymptomatic carrier, meaning they don't even have a runny nose or a sore throat or any symptoms at all. And yet what they have found over the course of the pandemic is 55% of all diagnosed cases of COVID-19 in the country have been transmitted to them by an asymptomatic carrier. So if we could have identified these asymptomatic carriers from the very beginning, potentially 50% of the cases that we've had since the beginning, wouldn't have happened.
And Greg, we have surveyed employees across the country to look at what are the conditions that will make you feel comfortable in coming back to work. And there's a good deal of unease at this point with people not knowing whether it's safe to be in the workplace. One of the important factors here is the confidence that it gives employees that they're not going to be picking up the disease at work from one of their co-workers.
Yeah, the first time that they do it, that, admittedly, even when Ian and I did it, there's a little bit of, I don't know whether I want the answer to this question or not. And so you're a little bit hesitant, but now what employers are coming back to me and saying is they can't wait for screening day. employees are all excited about coming into work and screening because, it gives them that sense of confidence, joy, and uplifts their mental well-being. They know they're keeping their family safe. They know their employers going to every extent to keep their family safe and them safe as well. And I think once you do it once, you almost get to the point where you're looking forward to doing it again.
In your home province of Ontario, we're seeing tightening restrictions in terms of the ability of businesses to stay open, and there are calls even to make those restrictions tighter yet. Should governments be differentiating between businesses that are doing rapid screening and those that don't?
Well, I think it's a good question. The way I would answer that is to say, there's no reason why everyone shouldn't be able to do it. I mean, as long as you've got access to these rapid screening, and if one of the tools, and we've been calling for two things. One is for rapid screening for a long time, but for probably 5 months now is medical grade masks. That a cloth mask, and Greg knows the stats better than I do, but a 2-ply cloth mask may be somewhere between 8 and 15% efficient. This mask from Eclipse Automation, which is a ASTM level 3 medical grade mask, is north of 90% effective at containing and we know it's airborne. We know it's coming out of your mouth or your nose. That's how it's spread. Those are two things that every business should be, there's no politics involved in that. That's just a better mask to use, and screening is going to allow you to stay open. I think, if the way to incent this is, we've had no problem with businesses getting on board. I mean, 1,000 businesses in 2 weeks proves the point that businesses want to take the tools if they're made available. So one of the pieces I know you're working on it at the Canadian Chamber level is working with the federal government, the provincial governments to say, hey, give us some modest money. Let's buy Canadian-made PPE and distribute them through our network in every community across the province of masks and rapid screening into workplaces. We don't anticipate that this is a short-term program. This is probably something in terms of screening and masks that's going to be with us, I hate to say it, for, in my view, at least 12 more months. I mean, before you're fully vaccinated, we have to understand whether there's going to be boosters required to keep the efficacy of the vaccines. So this is something that we got to get in place as a tool that businesses know that they can rely on and say, we're going to get these free kits and we're going to get these masks, especially the small and medium-sized businesses that can't afford to pay for it themselves. But it's such a great investment by both the provincial and federal governments in people and in business, because the only way out of this is for full vaccinations, but then the private sector economy are going to have to pay the bills after the fact. And we've talked about that many times on our show, that the importance of the private sector leading the recovery of the economy. And masks and screening kits are two of the tools that are the building blocks, actually, of growing our economy back up.
I think what we've seen, Perrin, as we go in and out of lockdowns is something that's been frustrating, I know, to you, to Ian, and to myself, is the fact that, we go into a lockdown and really it's kind of been evidence that what we were doing didn't work. So it's a bit of a failure exercise. And we seem to reinforce the definition of insanity by coming back open and doing exactly the same things we did before and expecting a different result. We never ever get that different result. So what Ian and I are basically saying is, look, you can't reopen the economy without coming out with more measures to figure it out. And back to your question about, should the government impose, you've got to be doing this before you can reopen. It certainly makes it a lot easier for the government to impose conditions like that when they're giving the tests away. So this is not, we're not telling you got to spend thousands of dollars doing some, new safety protocol. We'll give you the tools to do it. And we expect you to do it. And I don't know whether that would be an appropriate position of the government, but I can tell you, if I had a business, I would be doing rapid screening at least twice a week of all my employees, just to give us the confidence.
Well, and let's take a moment here to salute the federal government on this. We're often critical of what the government does or doesn't do, but your partner in this is Health Canada, who are making these millions potentially of test kits available free of charge to businesses across the country. And that's a vital contribution to public health. It's a vital contribution to the economy. as well. So that partnership is something that is very welcome.
Yeah.
And I think the partnership actually, Perrin, is Health Canada, but also the province. Like the province that broke the log jam, and to your point, now you're going through your colleagues to other provinces, is to say you got to change that rule that requires a medical professional to administer these tests. Ontario made that change. The federal government's got these 47 million of these have been procured. They're sitting in warehouses across the country. This program is ready to, it's ready to be unleashed using, again, as we say, make that change. You can get this started in a matter of days in every corner of this country, because we know that's what we did. We got kits. We put it on our website, our chambercheck.ca website, said, let's go. And it's not that complicated, but it's something that's easy to do, easy to replicate, and is going to make a huge difference in the short and medium term.
Let's just underscore this question of simplicity, because some people will be apprehensive, saying, well, provinces wouldn't have these restrictions if there wasn't a need for somebody who was medically trained. Greg has put a video up on YouTube showing how simple it is to do. In the case of the United States, you can go into your local drugstore and buy these test kits to be able to test yourself. And in Britain, the British government has a program where they're supplying free test kits to homes across the country, asking people to test themselves. So it's in other jurisdictions, it is not a requirement that somebody be medically trained, because it's so simple.
I think one of the things, Greg, didn't we hear from somebody on one of our planning calls that in the UK, I think they're doing 1 million kids in schools. Kids are doing it themselves. They can't come to school until they have done a rapid screening kit. And I don't want to denigrate basset hounds, but a well-trained basset hound could do this test, because Greg and I did it, and it is very simple, easy to do, and it's quick. And so it's got all it's got efficacy. It's just a great tool for every business to be doing, along with masks. And those are the two simple things.
Once we did them, I couldn't understand, like, why would a medical professional have to do this? It didn't really, in fact, it's safer to not have a medical practitioner do it, because when you're sticking something up in your nose, you don't want somebody else sticking something up in your nose. You want to be doing that so that you can monitor how far it's going in, and it only has to go in an inch, a couple of centimeters, but it's a pregnancy test is really how it operates and how it works. And, women have been buying pregnancy tests for decades, and utilizing them at home and identifying their own circumstances. And this is really important. It's really important that people understand that whether or not they potentially are presumptive positive, and if they are presumptive positive, they must immediately verify that with a PCR test and isolate themselves so that they don't spread it around and potentially hurt somebody they love by giving them the virus.
One last area I want to touch on before we wrap up here, and that is the role of chambers of commerce across the country in their communities at a time of crisis like this. What Kitchener-Waterloo and Cambridge have done is to demonstrate a very direct contribution that you can make in supporting businesses in your community. And you talked earlier about the Chamber Check program that you folks are running. Let's pull back to 30,000 feet here. Can you talk about the role of the local chamber in the community and the job that you perform during COVID-19 and during crises like this?
Well, maybe to just start that, I think I would say all of our chambers. I know Greg is doing the similar things that we're doing in Cambridge as we're doing in Greater KW. We're involved in physician recruitment. We're involved with the Immigration Partnership of Waterloo Region and immigrant employment. We're involved in policy on any number of different fronts. So we're doing all those things. And it's important work. I don't think a lot of people recognize that as being, or unless you're in the chamber movement, you may not know that. We're doing networking events. We're doing the education events. I guess the takeaway for me to kind of come back is that when, and Greg's right, we got a great personal relationship, but we've worked closely as chambers in a lot of different ways. But this pandemic has proven to us that there are more things we should be doing together in sort of a regional basis, and I would say that's probably true right across the country, And that's why this chambercheck.ca, which is, it's not the greater KW, it's not Cambridge. We're saying that's the repository where we can open source things that are important to all businesses. So what's in there now, if people check the website, would be certification training with Axonify that gives you the training that you can do online, takes about an hour, but you're given good information to keep your workplace safe. The rapid screening kits and the masks that you can order, take that into your workplace. We've had, and Greg and I do host this, Ask the Expert on all the cash flow support programs that have come up through COVID, because those can be complicated. We have accounting firms and others that join us to say, here's how to navigate through. And we're starting one in a couple of weeks, an ambassador program with the region of Waterloo that we're going to put in there to have actual people go into workplaces if they want it, to be able to say, what are some of the things you can do to keep your workplace safe? So when we look at chambercheck.ca at the 30,000 foot view, my view is there are practical things you need to deliver for business, for any small or medium-sized business in your community. And the things that we're doing are pretty granular. They're really like, it can make a difference in your business to wear masks, or to get those 50 or 100 masks, to get those screening kits, to do that certification that you feel confident. And it's confidence for yourself, for your customers, for your employees. And that's good for the whole community. So when I look at this and say, I've never been more proud to be at the Chamber, because, between you at the Canadian Chamber and Rocco and the Ontario Chamber, we're just getting stuff done. And I think that's one of the things that we get a little frustrated, Greg and I. Bureaucracies are bureaucracies and they move slow, and business needs to more quick wins and tools that are given more quickly. And that's what has been so exciting about this whole website of chambercheck.ca. We can just add stuff in, and we have. Over the last 12 months, we've now got 5 programs. And Greg, I would throw it to you and just say that it's made a big difference in being able for us to be able to say, here's what the Chamber can do, because there's practical things, not only for our members, but for the entire community.
And Greg, just before you pick up on that, let me underscore one point that both of you have made, and that's that you're focused not only on your members, but on all of the business community.
Yeah, yeah, we're not to use an overused pun, but we're all in this together, and we all need to demonstrate some leadership. But I think what's important, and I've been in the organization of the Chamber of Commerce world for 20 years. I formerly owned my own business, and I kind of knew, what my job was owning a business. I was kind of the leader. And I think I look at Chambers of Commerce now being that community leadership organization. We care about all 4 corners of our community. We understand very clearly that the economic strength can help the social fabric in our community and make a better, healthier, safer community together. And I think what good or great leaders do is they don't lead by leaving some people behind. They lead by bringing everyone with them. And I think that's really what we've demonstrated here to ourselves, is that our organization can be that leadership organization to say, you know what? Nobody wants to do this because it's a very difficult job, and there's nothing in it for anybody other than there is in it for the businesses that we're providing help for. Let's just get the job done, and we'll help people through this. More particularly, we'll help the entire community through this, because the vast majority of our community works. And if we're testing them, we're going to be keeping families safe as well. And that's so important to our organization.
And I think that's a great note on which to wrap this up. Thank you, both Greg and Ian, for the leadership you're showing within your communities. The passion that you have here for supporting the community is obvious. And you've provided leadership for the whole of the country in terms of providing an example of what organizations like local chambers across the country can do to support the communities in which they operate. Thanks so much for being with us today.
Thank you.
Thanks, Perrin.